One of my favorite programs to work with a patient with upper cross syndrome is what we call scapular PNF diagonals. And when we talk about scapular PNF, or we talk about PNF in general, what we're talking about is diagonal movements that incorporate multiplanar motion across a couple of joints in order to facilitate better coordination. So it's less about the contract relax that we often refer to it as, and more moving in a direction of movement re-education. And so for the scapular PNF, what we're going to do is contact on the inferior angle of the scapula with your inferior hand, and then on the acromion with the superior hand. The arm should be relaxed down, and I usually start by working on scapular mobility. Now the diagonal we're talking about here is bringing them into depression with retraction, and then protraction with elevation. And obviously the focus for mobility on a patient with upper cross syndrome is going to be on that depression with retraction, bringing the scapula down and back. As the patient gets improved mobility, then we'll start to work on that neuromuscular re-education. And so I'll ask them to go ahead and activate these muscles down here in order to hold as I try to pull up. This gets them the isometric contraction, so resist me down there, the isometric contraction that allows them to get better control of the scapula on the inferior side. Now, that is also a great way to teach the patient which muscles, if they've never felt what good scapular control feels like. Then from there, I'll start to work on strengthening by saying, all right, resist me about 30%, press this arm here, and then I'm gonna bring this up, resist, and then pull back. So pull down and back, good. And then resist as I pull you back up eccentrically, and then pull back again concentrically. And so we're just moving back and forth to help him develop his strength of the scapular stabilizer muscles.